Welcome to part 2 of insulin and diabetes. In the earlier part, we discussed about the causes, the various diagnostic tests, and also generally about the types of diabetes. In this part, we are basically focusing on the modern medical treatments available and the latest developments in medicine and surgery in insulin and diabetes. We begin with the first question on sugar control in blood. Actually, generally people have different views about sugar control in blood. Some think it is on the basis of maintaining a blood sugar level. Others think that it is on the symptoms, whether it is being under control. And then there are many who think that blood sugar is something that you cannot control constantly, but at least most of the time it is under control. What is your experience regarding how patients view this?
See, patients really very confused, and the most important thing is the general concept about the diabetes. The patients think that there is an insulin deficiency. So only 5 to 10% of the type 1 diabetic patients have an insulin deficiency. They are the only people who need insulin replacement. They really need the type 1 diabetes if it is established, whether it is because of type autoimmune disease or because of any reason the pancreas surgery has done and pancreas is partially or totally removed. Then the only option is insulin replacement. That is, for any hormone, if it is deficient, replacing it in the most natural way to mimic the normal level, human level. But it is not possible in many of the cases because our endocrine gland will be secreting according to our needs, but we cannot give according to our need. Even the insulin pump is not able to give just like our natural real machine pancreas. So that deficiency will be always there. For the insulin is needed for only those who are having a low insulin level, that is the type 1 diabetic patients. But 90 to 95% of the patients are type 2 diabetes. They don't have any deficiency, and usually most of them have, because of the insulin resistance, very high amount of insulin in their body, and we are treating in the wrong way. We have to say that because it's unscientific to give insulin to already high insulin level, and further insulin injection is giving to increase the insulin level is unscientific basically. But it has established in the society, in the medical profession, and also the people are thinking that is the correct way of doing it. And many will be worried about the tablet may create problem. So even I was also in that impression, and basically, when I was practicing reproductive medicine, obstetrics and gynecology and infertility and all, that time our understanding was so premature or very, very low about the diabetes. So for the diabetic patients, especially when they are pregnant, we don't give any tablets, only the insulin, because it's a natural thing, it will not harm the child. That was our impression in that days. So we'll be for the even gestational diabetes is a type 2 diabetes. So there also the insulin level is really high. But really what we have to do is reduce the carbohydrate intake. Instead of that, we are increasing the insulin, or insulin injections will be given, and the pregnant lady will find it very difficult to adjust with the insulin injections. It will be always fluctuating the hypoglycemia and hyperglycemia, and all the problem will be there. Finally, many of the children will be overweight. Obesity comes in the in utero itself, and the problems associated to that also will be there. So what we have to understand is, in the type 2 diabetes, insulin is already high. No medication which is increasing the insulin, whether insulin injection or the intranasal inhaler, or the medication which is increasing the insulin level or the pushing the pancreas to produce and release more insulin, is scientifically wrong actually.
Actually, when we are talking about diabetes, most people think that diet and all is basically restricted to certain things like avoiding sugar and so on and so forth. But it seems that diet is more than that. it is not just sugar adds to sugar in blood, and something it's not that simple. At the same time, this also creates a problem for most diabetic patients because they are also confused regarding diet. What is your experience about what is the general understanding among patients about diet?
Generally, people think that all the diabetic patient and the general population think that I'm not taking any sugar, doctor. I'm not taking any sugar, but my sugar is so high. See, we should understand that the sugar is actually what is it is converted to. It's a disaccharide. It is converted to glucose and fructose. And the rice and wheat and other even the vegetables what you are eating is also carbohydrate. All the plant material which is we are eating, even the pulses what you are taking is mainly carbohydrate. Carbohydrate it won't be sweet, but sweetness comes only for the sugar that is disaccharide, the common sugar we are using, or the fructose or the glucose or the lactose or galactose. These are having the sweetness. But even though starch doesn't rice have any sweetness, but the rice is fully converted into carbohydrate, glucose. So if you are eating 100 gram of rice, it is almost equal to 100 grams of sugar itself. Only thing, sugar, if you're taking this disaccharide sugar, the sugar will be increasing very fast. For if you are eating tapioca or the rice or the wheat, the rice will be little slow because the digestive process also will be taken place. It has to digest too, and it has to convert it into glucose, then only it will come. So the people is, if you're even, I had seen patients who just salads also, the diabetic patient who are really diabetic, even the salads will increase the sugar. You can check what all things, if they take it single plantain or single apple, the sugar will shoot up. Because your body doesn't want any sugar, any glucose, and your body is not able to handle the sugar. That is the reason. Simply, they don't want it. The body is not able to, if the excess sugar is there, it has to be converted to fat. The liver, all these patients, these type 2 patients, the liver cells will be filled with fat and they cannot take up even the sugar. So the sugar has to run inside the bloodstream itself. So that is the reason for this sugar is increasing, and all the diabetic complications come because of the damage produced by this high sugar. It is actually directly damaging the blood vessels. The blood is traveling through a tunnel, no? So the covering is there. The cells are damaging. That is why the fine blood vessels like retinal, eye blood vessels, kidney blood vessels, they are getting damaged. That is the reason for nephropathy, even the neuropathy. There are very small, fine blood vessels are supplying the nerves, and they are getting damaged. That is the reason for the neuropathy.
Actually, in the case of medications, there are so many medications for type 2 diabetes. Some actually pressurize the pancreas to produce more insulin. Others seem to be acting in different areas of the body to reduce the impact of glucose or conversion of glucose, and some impact the liver, some the kidney, and the basic drug like metformin, it acts in another way. But all of these drugs seem to be having some sort of side effects, either gastric issues or stressing the pancreas or stressing the kidney or stressing the liver and so on and so forth. But now what is seen according to general information is that multiple medicines are given so that some sort of a control is obtained. That means you are giving sometimes 3 or 4 medications for diabetes. What should we understand of that?
See, doctors are trying all the available measures what they have. Whatever, there are so many medication in our basket, and we'll try with one another. So But the problem with the type 1 diabetes, there's no role for any tablets. Actually, only this one sort of medications can give some benefit, but usually it will not have any much benefit for the type 1 diabetes. And type 1 diabetes, you have to take the insulin itself. And insulin itself, that the type 1 patients should know that insulin is actually in the initial stages. It was the porcine insulin or bovine insulin, that is from the pork pancreas, it was derived. And then in the next stage, actually, the this porcine insulin and the human insulin is different. There is some difference. That is actually single amino acid difference is there. And bovine insulin, I think 2 or 3 amino acids are different. So then we are able to synthetic insulin, partially synthetic insulin from the porcine insulin to make artificially one this amino acids is replaced and made the human insulin. That is in the, I think, in the 80s. And immediately in the next within 1 or 2 years, we are able to do the biotechnology methods and was able to make the yeast or the E. coli bacteria to make your human insulin. So it is more of the human insulin. That is why recombinant rDNA insulins. So, but after that, actually there are so many, actually that is the initial stage, and we are able to get the human insulin itself. Either from the porcine, it is changed over to human insulin itself, and then we are much more easier method or the biotechnology. But after that, what happened? This people are the companies have started, they want new patents. The patent will expire 15 or 20 years, so they want the monopoly and they want to this thing, and they started making it different. Not only for that, they were expecting some may be beneficial for the other things, but principally you cannot, according to the law of the nature, the more natural is the more better. But later what happened, this insulin analogs that started changing 1 or 2 amino acids or some polysaccharide of this natural human insulin and made analogs. Now there are so many analogs are also available. So actually they are not the ideal. Actually the ideal, always stick, especially those who are taking the type 1 diabetes who need the insulin. They should always stick to the most natural form of insulin. Otherwise you will get this autoimmune diseases, because your immune system will start producing antibodies and finally the insulin itself will not be working, and also you can get other autoimmune diseases also, because you are actually stressing your immune system by giving unnatural things to the body. It's always just supposing this recombinant human or this semi-synthetic porcine insulin was the better because it is more natural. But when we shifted to the analog insulin, it is actually troubling you. And for the type 2 diabetes, there's no need for insulin. The problem is with your insulin resistance. Only those medications, very few medicines only have some action by reducing the insulin, this insulin resistance. That is the first line of management is metformin. Metformin, actually we don't know exactly how this metformin is acting. It is actually reducing the insulin absorption, this carbohydrate absorption in the stomach, and also there is some effective things that insulin resistance will be reduced, and also it is acting on the glucagon mechanism. That is, glucagon is another hormone which is working parallelly. Insulin is trying to reduce the glucose level, but the glucagon is trying to increase the insulin level when you have it. When you are not eating food, there will be the body itself is producing. If you are fasting for a day, then you cannot. The glucose level should be normal, because your nerve cells can function only if there is a basic amount of glucose is needed for the nerve cells to function. But all the other cells in the body can function without the glucose. Even the nerve cells can take over. Nerve cell function can be switched back over to the ketone bodies and all, but it will take some time. This is the reason if you fast for a long time and you don't take the same food, you get tired and giddiness and all happens. Especially the diabetic patients who are on insulin get a frequent hypoglycemic attack, because most of these patients, the glucagon mechanism also will be affected. Glucagon is produced by the alpha cells. There are 2 types of cells in the pancreas, that is one is alpha cells and the beta cells. Beta cell is producing insulin and alpha cell is producing glucagon. That is, the glucagon mechanism will be also in under abnormal or dysregulated. That is why some of the patients who are having, even they, after the diabetic patient, especially type 2 diabetes patient, after exercise, their sugar will increase. One of the reasons is that their glucagon is also not functioning. When you are doing the exercise, the glucagon, if it is over expressing the glucagon activity, the sugar can go high.
Actually, nowadays, surgery is also considered an option by many because they feel that if they undergo bariatric surgery, they may be able to overcome diabetes type 2. And then there is this question of this islet transplant, or I think even the transplant of the pancreas itself. What is the current situation?
See, the pancreas transplant is considered for the type 1 diabetic patient. And also this islet cell transplant also for the type 1 patient who are not able to, it is not for everyone, which is not able to get any control or weaken hypoglycemic attack, etc. Then you can think of, but it is, the result are not very promising. Because if you are going for a transplant, you have to take the immunosuppressants, which include steroids and all. The steroids, otherwise itself, it is very diabetogenic. So the role of pancreas transplant and the patients, it's all in a trial basis actually. There are pancreas and the kidney is transplanted in the same time. Actually, in the pancreas transplant, actually the original pancreas is not removed. Only second pancreas is fitted in, around the intestine, and maybe along with the kidney also if the patient is suffering from kidney failure also. So it has not much role, but we can try, that's all. So we always, the doctors also want to know what we can do. So that way we can try that, that's all. Then next is the islet cell transplant. That is also only for the uncontrolled type 1 diabetic patients who are suffering from frequent hypoglycemic attack and all. In that actually the donor islet cells are separated and it is injected into the liver and it will get into embedded in the liver cells and start producing this insulin. But here also the problem is you have to take immunosuppressants heavy dose. That is the problem for these two things. So that is the reason even initially they may be able to come out of insulin for a short while, but after some time you had to start with insulin and that will be the usual thing. It is not that promising actually. Next is bariatric surgery. Bariatric surgery is done for basically the type 2 patients. That is obesity. The reason for their diabetes is obesity and overeating. So bariatric surgery, what they are doing? You are forced to cut your food. So a part of the stomach size is your stomach can dilate up to 1 liter. 500 to 1 liter, or even we can take more than 1 liter water. There are people who can, this competition and all, eat so much, no? So that is capacity of our stomach, it can dilate. What in the bariatric surgery, the stomach size is reduced and it is reduced to around 15 to 25 ml. So you can't take more than half a glass of water or something like that. Only thing after the bariatric surgery, gradually again the problem is our body that try to adjust when you are eating and it is gradually increasing in size, and when you are started eating more and more food, your weight will again started increasing. And in bariatric surgery, not only the stomach size is reduced, and a part of the intestine, especially the upper part of the intestine, is blinded, it is bypassed, so that the food will not be get absorbed. The problem with this is many of the nutrition absorption also will be compromised. So you may have to take vitamins, injection, mineral injection, even without your body, because your body is made of your food. So you are forcefully made not to eat, and also if you eat, it will not be get absorbed. So you have to face all the complications of that. But if you are willing to control the food, you don't have to go for bariatric surgery at all. So it is not really an answer, because really if you are doing the bariatric surgery, you can get a fast weight reduction, but the skin and all will be sagging of the skin will be coming, and you can watch the photos and videos of the people who was with the sagging skin and all. You should look into that, then only you will think of doing such a surgeries. The on the table complication itself, which is a major surgery, because even though we are now, we can do the surgery by the laparoscope, endoscopic surgery. There will be only some even though there will be at least 3-4 wounds in the abdomen, but it will be small wounds will be there. And there are even the stomach is cut open. It's a major surgery, so much complications can occur. Even the death can also occur with the bariatric surgery. Even if you after successful bariatric surgery, also there are so many people who I had also many people who are after 1 or 2 years or 3 or 4 years they started increasing the weight again, because after bariatric surgery also you had to do the exercise and the food control. Then why don't you do it without this thing and reduce the weight? And after the bariatric surgery, after this fast weight reduction, the skin will be sagging will be there. Then you have to undergo a lot of, if you want to be really appearance and all to be correct or feel comfortable, you have to undergo a lot of cosmetic surgery also to remove this skin, loosen the skin and tighten the part and all.
I have heard, some people say that instead of reducing the size of the stomach or reducing the intestine capacity or absorption level and all, any day it is possible to remove only the visceral fat alone in the body, in the abdomen and all that, then we should get a direct result of benefit for diabetes.
No, it's actually you can tummy reduction. This suction directed liposuction surgeries are common, but it is actually not much use, because you will be able to maximum or 6 to 7 kg fat can be removed from that is subcutaneous fat. You cannot do any surgery for the visceral fat removal. Visceral fat is actually there is omentum, and that is one curtain-like things in the stomach is there that you can remove and all. But it is a protective covering actually. You cannot remove the visceral fat as such, because it is actually protecting the viscera. Only thing it is overfilled. Even you might have seen the cardiac surgery, this heart patient's heart, because it's covered with fat. Actually, the fat is the problem, the heart patients. So the lungs and every arteries and veins, the artery, vein, and the nerves and lymphatics is traveling through they're traveling together actually. It is actually covered with fat. So that fat content will be excess. So you cannot remove the visceral fat as such, just like with the liposuction or anything.
Regarding these insulin injections, nowadays we see there is the option of insulin pump, then there is insulin inhaling, and so many options we are seeing. So what is it that a diabetic patient should know regarding this?
See, this insulin is definitely needed for the type 1 diabetic patient. And it has short acting and the long acting and intermediate acting. Some different type of insulin is there. So it should be taken accordingly. It's an insulin replacement is the only way out for that. And for that intranasal, that is actually in the powder form, and it can be inhaled. But it has its own complications also, especially pulmonary hypertension is one of the complications, and the irritability and allergy and so many problems. But if you can tolerate that also, you can consider this intranasal also. The patient, depends on the patient. I think in India, till it's only coming recently. Only that main company actually in one of the company in America has developed it, and another company or they are themselves marketing. And anyway, India, one of the company is taken it for marketing here, but not in the market, and we don't know the price also. It is not announced. But in America, it was not moving very successfully. So there was so many problems. Even if it was the first nasal insulin is withdrawn from the market, and the second, I think, is now market running. But it was not moving in the America, this US itself, and it is coming to India. That is, maybe we can, type 1 diabetes patients, definitely they can think of, because especially when they're traveling, if it is a nasal spray, it will be, or inhalation, it will be definitely more convenient. But we should watch for the complications also. For the type 2 diabetes patients, according to me, according to my experience, the clinically supported lifestyle correction, we stop all the diabetic medication in the first day itself, because the lifestyle correction means low calorie diet, especially low carbohydrate diet, and physical exercise. If you are given on a low calorie diet and doing physical exercise, if you take insulin or any hypoglycemic medication, the hypoglycemia can occur. So actually, the hypoglycemia is more dangerous than hyperglycemia. I have seen patients with around 600, blood sugar level is 600, but they are walking around okay. But if the patient is going to below 60 blood sugar level, it will be very dangerous. And if you are 45 and all, you become unconscious. The brain will not be able to function, so the patient will black out and the problem will be there. So we stop the diabetes medicines and all the insulin, and the patients will be worried. They will be asked, "Doctor, I am taking for the last 25 years or 30 years this insulin and medication. How can I stop? Will it make any problem?" So it's very simple. It is sugar, blood sugar. It is so easy. You can check it at home itself. And now that continuous monitoring system for 15 days is there. You can connect it to your mobile and see what is the sugar changing. So if the patient is following correctly, you can check the morning sugar. If it may be 200 or 250, whatever it is, within 12 hours itself it will come down. With the evening or within 24 hours it will be normal without insulin or diabetic medicines. Even those who are suspecting a type 1 diabetes, the patients with adult also, we see the patients with low C-peptide and low insulin level also. For those who are taking on insulin, the insulin will not be dependable, but the C-peptide level is low. That means it is a type 1 diabetes. But those patients also we stop the diabetes insulin, not for the if the C-peptide level is at least 0.4 or something like that. If the C-peptide is nil, we cannot do that. That means it is a totally a type 1 diabetes. But if it is some level of 0.4 or something like that, C-peptide level is there, usually after clinically supported lifestyle correction, the pancreas will start repair, and they start producing more insulin. Within a week or two, their insulin, the C-peptide level will and the insulin level will increase. So that is also very common. Like I have seen many patients who are diagnosed as a type 1 diabetes, but we are able to increase. That depends on the C-peptide level in the initial stage. And if it is needed, the will initially itself will say that if your sugar is going high or ketosis or something develop, we will restart. Maybe if the sugar is going high, definitely for the with all the measures, if you are following the low calorie, low carbohydrate diet, and the sugar is going high, then they need insulin injection. But for the type 2 diabetes with a normal C-peptide level, they don't need. If they are following, it is 100%. If they are following the diet and doing the exercise, it's almost 100%. They will be getting much better blood sugar control within 24 hours itself. And you can because it is easily you can check the blood sugar level with a continuous monitor or 4 times a day with home monitoring. It can be enough actually.
See, this when a person is diagnosed as diabetic, at that time it is rarely that they are introduced to insulin. But what is seen is almost 1/4 of the patients who have diabetes are actually on insulin. That means out of 4, 1 is on insulin. At the same time, it is said that it is not good to be on insulin for long, because then hyperinsulinemia and all that. Why is this so?
That is the misunderstanding of the people and also the medical fraternity as such. because it is this system of treatment and all developed many years back. That time this sort of testing or understanding was not there. But the modern medical fraternity is not able to change according to the real scientific development which is happening. And actually what I am saying is the most those patients who are coming for the clinically supported lifestyle correction also, their much resistance is from the medical, their own physicians itself. They're not allowing them to. And if someone is asking their physician, the doctor, I am going to this trying for this clinically supported lifestyle correction, and what is your opinion? They will definitely say this is all pseudoscience, and it is alternative medicine, that is pseudoscience. Actually, there is this natural things, anything which is considered around 100 years back. Actually, all this modern medicine changes and all came during the last 100 years, especially in the last 50 years or 75 years. So here, this natural things, all the diet or the exercise, so these things are considered as a pseudoscience. That is the problem. And I have many patients. Even last day itself, one patient who came to me and told that he's a very educated person, and many of his relatives are doctors and also very famous people. And he was telling me, I have not told anyone. If I tell anyone, they will not allow me to come here and start this treatment. And that is the situation. Actually, he started his treatment and he's out of the insulin and all the medications the next day itself. So only after, if the patients is coming also, many of them are afraid to talk to others. Only after the completion they will be saying, and in that case also they will be troubled by saying that reduction in the weight. If the patient was 100 kg and came down to, is actually with the clinically supported lifestyle correction, almost within 3 months, if the patient is following correctly, 20% weight reduction is possible. And there are people who has 25% also achieved, but we are actually expecting 15 to 20% weight reduction. That is our target actually. And the patient 100 to 80 kg, the people will ask them, who don't reduce the weight, and it will be harmful for your body, and so your become your beauty is gone, your personality is gone, so many trouble will be there. But if you weight reduction without monitoring, without the proper guidance, if it is scientifically done, ensuring the enough nutrient is there reaching their body, then there is no problem. You can reduce around 20% within 3 months, and the first month almost 10% reduction is possible. And with the first month, you're not coming out of the diabetes alone. Most of these patients who are coming will be having hypertension, dyslipidemia, arthritis, even the kidney, that is the major problem now. Kidney failure will be there, the GFR is gone high, proteinuria, albuminuria will be there. All this will come down. Actually, within a month, you can come out of almost all the medication. Only in rare situations, some of the medications like blood thinners or something is need to be continued. Like if a person is on a pacemaker, then they have to continue the blood thinner. All the other medications and also can be stopped within a month, provided you see all these diseases are lifestyle diseases. You should understand that. And the BP medications can be, maybe many of them are taking BP medication for the BP 3-4 medicines, because the insulin is the culprit for increasing the BP actually. What happens when the insulin, it's a sodium retainer. We all say that don't take common salt. Produce the common salt for the BP patient. But what happens is in the diabetic patient, the insulin is a sodium retainer. That is the problem. And insulin is producing this immunity will be reduced. There is a reason for the patients, the glucose is not controlled, then it is a very good media for all the bacteria and viruses to grow. And also, this phagocytosis will be, that is the immune capacity will be reduced, and that is the reason for the cancer also. So the diabetic patients can get a high chance of getting cancer and this infections also. There also when you are reducing the insulin level in the body, definitely chance of diabetes is also, this cancer also reduced. The patient with the cancer and diabetes, you should concentrate not only on the cancer, you should control of the blood sugar is more important. Not only the blood sugar, the insulin level should come down. Then only you can come out of the cancer also.
With this, we come to the conclusion of this second part. Here, we were basically looking at what are the current medical options for treating diabetes and the role of insulin in this. In the next part, we look at various comorbidities and complications associated with diabetes and insulin. Thank you.